Everybody, this is Travis Robbins, and we are doing our Ask a PT segment. Today I have Dan with us, and we got a question from Linda. So Linda says, "What exercises can I do to improve the arch of my foot? It seems to be falling, and I would like to prevent that from happening." So this is something we really commonly see. I'm sure you've gotten this question before in the clinic, Dan. What are your initial thoughts on someone who's having this problem?
It's pretty common when we see patients coming in with like flat feet, as their doctor would probably tell them they have. So it's a pretty common issue. Definitely like treatable. Maybe you should definitely see some improvement, but that might take a while as far as like your actual arch height. But you can definitely like change if you're having any pain from it pretty
Okay.
quickly.
Yeah. And I think things that I look at is like, is this happening on one side or both sides? So let's say it's for this person, we don't know. If it's just happening on one side, what are your thoughts there? Like, what might that indicate?
When I see it definitely on one side more than the other, I usually almost tend to look at their hips first more than their feet, because it's usually how their like pelvis and hips are stabilizing. They're usually kind of biasing one side, so it's causing one side to be higher, one side to be lower.
Got it. And so I think common treatments that people will see is, well, oh, if I have flat feet, I just put orthotics in. So what are your general thoughts on orthotics for this type of problem? Although Linda is saying, hey, I want to do some exercises, but just talk a little bit about how orthotics can treat this and maybe how they might be overused in some situations.
Yeah, so orthotics might be beneficial like short term. They're not going to fix the issue, and then seeing a lot of patients like the orthotics really aren't made to last that long. They do wear out. And like I see patients come in with a pair of orthotics they've had for 20 years. Like it's probably not doing what you think it's doing anymore. But yeah, they can be good. There's good evidence for them like short term, but you should be doing exercises in like your off time to kind of wean off of them eventually.
Yeah, I think that's a really good point. Similar to like back bracing or any kind of bracing, orthotic is a brace of some sort. It's trying to do something external that your body's not doing. And you would tell someone, I mean, the example I give is like a cast when you have a fracture for your arm. Like you'd be casted for a certain period of time. You don't leave that cast on forever, right? You would take it off at some point once there's some healing that's going on. So the patients that we see, they might be coming in with plantar fasciitis or posterior tib tendonitis or any kind of medial foot problem because of a fallen arch, or even sometimes a lateral foot problem because of a fallen arch. And they say, yeah, I got this brand new orthotic and I feel a lot better. We say, like, well, that's great. Let's get the inflammation calmed down. And it's good for a short-term use. But you wouldn't keep a cast on your arm for the rest of your life. You wouldn't. Same thing with back bracing, although this does happen more commonly than people keeping a cast on their arm for the rest of their life. It's like, oh, I have a back brace. I just put that on as soon as I wake up and then I take it off when I go to bed. Like that's, one of the worst long-term things that you can do for your back. Anything external that's doing the job that the muscles are supposed to do, once taken away, your muscles are going to be like, whoa, like you said I didn't have to work anymore. You gave me this external thing that was going to do the job for me, and that can be bad. So it's important to think of that as a short-term use. Now, there's some people that have structural flat foot that there is almost nothing that we can do to raise the arch. We can treat the symptoms. That they're probably going to be in an orthotic a good chunk of their lives, but that is so rare, like such a small percentage of people. Most people are people that should be using that on the short term. Okay, so let's get to the question here, which Linda asks, which is like, what are the exercises that I can do? I want to try to improve either like one-sided arch lowering, or maybe most commonly it can be both-sided that are lowering, and she's noticing this. What are some exercises that she can do to help her out?
Yeah, so as far as like lifting a flat arch, I mean, we can definitely do some foot exercises. Like do things called arch ups, or short foot is another name for that. You can do toe yoga, which is kind of, both those are just working on the little muscles that run on the bottom side of the foot. Um, Probably tight. So you want to do some kind of calf stretching, whether it's straight leg, bent knee to hit both of the calf muscles. Um, Definitely some heel raises in there. You just have to pay attention to how you're doing them, and that you're not just rolling your whole foot out or in as you're doing them. So you want to try to line the heel up with like the second toe as you're raising up. And if you're deviating from that, that's not going to be as helpful. You're still going to build some strength, but and then moving up to the hips, you can do things like bridges, or if you can do like a lunge or a squat, more of a reverse lunge would be better to kind of help lift that arch, get the weight back on the heel. Um, yeah,
Yeah.
stuff for the lateral hip and the glutes is going to really help.
Yeah. So as in any situation, when you say, "Hey, what's the best exercise for this problem?" It's like always, well, it depends. And to give you the most effective way of treating this, we'd have to kind of take a look at you. But in general, if you did those things that Dan said, it's probably not going to hurt you. So those things can be helpful in raising the arch. So, Lynn, I hope that helps out a little bit. If you have more questions about that and want us to take a look at your foot, you can always come in for a free screen. It's free, 30 minutes with one of our PTs, and we can check things out and give you some more help at home. All right. Thanks, Dan. I appreciate your knowledge, and we'll talk to you soon.